this section is very important. First of all, it's going to be some questions in your quiz. But second of all, if you would have a patient in the future, or if you would have a stress in the future, I mean, you do have a stress even now. But the point is, if you are just struggling or encountering with the stress at some point, this part going to help you a lot. So just listen to me carefully. Here we're going to talk about how stress going to impact our body and compromise our immune system. There are going to be four direct ways that stress going to impact us. The first one going to be physiological effects. First of all, it's going to actually increase your blood pressure, your heart rate in a very negative way. It's going to increase your hormonal activity, again, in a very negative way, not in a good way. And it's going to actually decrease your immunity because of the negative hormonal activity, right? And heart rate and all that. It also elevates your lipid level in your body, which is bad. Another direct impact of stress gonna be health behavior changes. So basically, it's gonna increase your smoking and alcohol and drug use. We all know that whenever people are seeking for like some solution to just reduce their stress and anxiety level, they're gonna just distract themselves by alcohol use or doing drugs. Stress can actually compromise your immunity again because you wouldn't care about your food intake or nutrition. You're gonna eat sugar, you're gonna eat fatty food to just comfort yourself because they are comfort foods. It's gonna actually decrease your sleep. Yes, of course, whenever you do have anxiety, you cannot sleep at all. Whenever you are stressed out, you cannot sleep well, and it's going to impact your sleep cycle. And it's going to bring you poor diet and little exercise. So this part can be a bit challenging because some people like myself, whenever we are stressed out, we do have a coping behavior in which we're going to just go to the gym or go running to just reduce our stress level. So this part cannot be for everybody, but in general, it seems like whenever you are stressed out, you would do less physical activity. But it is different from one person to another. About poor diet, we already talked about that. If you would remember, there was a question, I guess it was in your quiz 5, about a celebrity character, Shiv Roy. She was very stressed out and all that. So she was just seeking for some good health, like healthy behavior for her diet. And at that point, we said that whenever a person like Shiv, they are just stressed out, they are distracted and they are not controlling over their sugar and fat intake. So, and they are not doing any meal prep or diet. So that's why they are just eating unhealthy. So just keep that in your mind. Whenever you are stressed, you do have like some sort of decrease in your nutrition. I mean, good nutrition, and also you're gonna have poor diet, definitely. I mean, this is definitely happening whenever you're stressed out. Psychosocial resources. So in general, stress gonna threaten your social support. You're gonna be very isolated. You wouldn't interact with anyone because you feel like, okay, everything is just very negative. No one can understand me. This is my problem, which actually leads to another part of negative impact of stress because it's going to reduce your positivity, optimism. You are always negative. You feel always like negative about everything. You feel like if, for example, you would lose your job, you cannot get any other job and you're going to be homeless. Your family going to be like in a very bad situation and all that, like all the negativity going to come to you whenever you're stressed. It's going to actually threaten your self-esteem. Of course, yes. Whenever you're stressed, it's gonna do that to you. And it's gonna lower your sense of mastery, which again makes sense. You don't have control over anything. So you can see that how previous chapters actually addressing this part in a good way. I hope you would remember from previous chapter, finger crossed. But yeah, stress also impacts your healthcare behavior because you are not seeking for any treatment. You feel like, okay, everything is just negative. Why should I just go and just seek help for myself? And yes, you are not seeking for treatment and you are not seeking for healthcare or anything. So here we're going to talk about, this is like another part, we're going to talk about the physiology of stress. So whenever stress is just happening, there are going to be two big systems in which they're going to interact with each other. Number one going to be sympathetic activation, and number two going to be HPA. That's fun. Hypothalamic, pituitary. Good luck just reading that. adrenocortical, HPA axis. But yeah, you don't need to necessarily know about this. I know there are like some pre-med students in the class, but I mean, we can ask them to just say the full name, but I mean, I cannot do that. But yeah, so they're gonna be two systems. We're gonna call sympathetic activation as SA, like the way your book did, SAM. And the second one gonna be HPA axis. So we already talked about sympathetic activation or SAM. So whenever you do have a stressful event in front of yourself, your brain, which gonna be cerebral cortex here, gonna like actually evaluate the situation, appraisal, if you would remember. And from cortex, some hormones they're gonna go and some signals they're gonna go to hypothalamus and they're gonna initiate sympathetic behavior. What was sympathetic behavior? Increasing in your blood pressure, increasing in your heart rate, sweating. Like you can see, whenever you are just doing public speaking, you definitely experience that. Like your heart is just going crazy, you're gonna sweat and all that. So all of them, they're gonna be SAM or sympathetic behavior. And in general, you're gonna have that kind of cranked up feeling, like heart rate, sweating, and all that. However, there's gonna be another system that actually gonna help sympathetic activation to just be like a bit balanced, like your body would be balanced, like not go crazy. So another system that's gonna fight with sympathetic activation gonna be parasympathetic functioning, which actually help you just calm down, to just, be normal. Because like whenever you are doing public speaking, in the beginning, you do have high heart rate, but parasympathetic gonna fight with that crazy cranked up feeling. So you're gonna like after a minute, you're gonna look at your audiences. You see that everyone is calm, they are listening to you, you are doing great. So that parasympathetic can just help you to just regulate yourself, if that makes sense. At the same time, we do have another system, HPA. This guy gonna release hormone, one important hormone, cortisol. Cortisol is just in general stress hormone. It is very important. It is very helpful, but up to a point. We already talked about that graph, which had like three different phases: alarm. I forgot. My goodness, I forgot. It was alarm, resistance, and exhaustion. So this hormone is just very much related to that part. In a normal way, you're gonna be like, whenever you do have one event that's gonna stress you, you're gonna release cortisol. That is fine because it's gonna help you to just store carbs, carbohydrates, and also it's going to reduce inflammation in case of injury, because like back then we were just all animals, so yeah, we had to just protect ourselves. So cortisol going to help you a lot to just fight or flight from that stressful situation, and it's going to just store carbs and reduce inflammation to just help you in case, like for example, there would be an accident, you're gonna, for example, get hurt and all that. So this is a good hormone up to a point. If you would be on the second phase all the time, resistance phase all the time, and if you would be stressed out for a long time, you're gonna increase cortisol all the way, and it's not good. Why? Because you're normal, like a normal person, a very balanced person, they're gonna release cortisol in the morning after they wake up, after they are just waking up, and but the level of cortisol gonna decrease during the day. However, it's gonna, I mean, we do have some peak around lunchtime, because we still need to just be productive, need to just work, but like during the day it's going to decrease. But a stressed person, like someone who just being stressed for a long time, they're gonna have high level of cortisol all the time, and it is bad for them, because if you would have it all the way, you're gonna develop cardiovascular disease, or you're gonna develop like bad habits, such as, for example, lack of sleep or bad nutrition, and like your immune system gonna be compromised because of that hormone. It is a good one, but in a negative way, it's gonna be if you would just be stressed out for a long time. So if you have a stress, you have to just address that. Either you have to go to a provider to just give you some, I don't know, prescription, or you should just practice some coping techniques to just address that. Don't leave your stress alone, because it's going to be very bad for your body. And that's my point. Here, we're going to talk about the effect of long-term stress. Like I said, it's going to impact your immune function in a very negative way. It's going to increase your blood pressure and heart rate all the way. It's going to bring you some bad mental and psychiatric problems. You're going to develop some cardiovascular disorders and disease. You're going to have problems with verbal functioning, memory, and concentration. This happening to me a lot, I'm telling you. Seriously, like whenever I do have, I mean, I'm just experiencing a lot of stress. Seriously, grad school can be hard. I'm teaching, I'm doing a lot of research, but long story short, whenever I'm just stressing out, I forget this stuff in a very bad way. Like it's not important one. I can remember important one, but for example, if I would go to the gym, I would forget the locker's number, and I have a hard time to just remember that. Or whenever I'm just going to grocery shop, I would forget uh, where I parked my car. So I seriously, I had that condition that I was just calling security. They would just come check the camera to just find my car. Like that's crazy. I know they are just small problems, but like because of stress, I might forget a lot, so they can cause some negative consequences for me. I'm sure that you guys are aware about that. But oh, stress, another part of that is just you're gonna store fat in your abdominal, which is bad, right? We actually talked about that. Whenever we are just actually having fat in our abdominal, it's gonna press your organs. So this way, it's gonna be very bad for your digestion, and it might just bring you cancer and other problems as well. And the last one gonna be, it's gonna impact your sleep quality, of course. Whenever you are stressed out, you're gonna have a bad sleep quality. So reactivity and allostatic load. Reactivity means like the amount of stress gonna be very different in one person compared to another one, and the consequences of that might be very different from another person to um one person to another. So basically, just saying that they're going to be individual variability between people to just tolerate different stressful event. For example, just imagine there would be a car accident, and two children, they lost their parents. Okay, maybe the sister can just cope better with that accident, like losing their parents, but like the brother, he gonna just lose it, seriously. So and that's the point. Or whenever it's gonna be one exam, one person might just feel stressed out, they might forget everything during the exam, but another person, they would just feel very confident, they feel like they are controlling everything, and they take the exam in the best way possible. Actually, now I'm recording this. I'm just checking your evaluation of instructor for the midterm. Oh my goodness. So I got one comment about a student. They were saying that they are just very nervous about final project because they don't know what is final project is about. Yet I said that I'm gonna just dedicate a week um, about your final project, so you shouldn't be worried at all. But I can understand that person too. So whenever you don't know what is the project about, you might get anxiety. But like I couldn't see that common in any other students' evaluation at all. But I can get that student, and because of that person, I'm gonna add more information soon about your final project. But yeah, I'm just telling you, you all 75 people have the same assignment, final project, but we do have one student who gonna be stressed out, severe anxiety, because they don't know what's happening. So reactivity means stress is just different from one person to another, and it's gonna impact immune system in different people differently. Allostatic load is just saying that the cost of stress, the wear and tear on your immune system, it just again different from one person to another, and it is very high for all of them. Like everyone gonna just experience some sort of wear and tear when it comes to stress. They're gonna actually compromise their immune system, but for some people it's gonna be worse. Indicators of allostatic loads. So basically, you don't have the ability to shut off your cortisol level in response to stress. You're gonna have lower heart rate variability. You're gonna have elevated level of EP hormones. And again, you're gonna have some fats in your abdominal part. Um, you're gonna have problems with your memory. You're gonna have cognitive problems as well, and your blood pressure level gonna be higher. Dimensions of stressful events. I mean, you feel like everything is just very negative. You cannot control anything. You're gonna actually be overloaded. Everything gonna be vague for you. Like you cannot actually do problem solving in the best way possible. And you feel like you're gonna lose it, like everything gonna be dark and negative. So this is all about dimensions of stressful events.